breaking barriers and bridging the gaps between patients and doctors. Welcome to Brainstorming with the Docs and your co-hosts, Dr. Glenn Harrison and Dr. Kolby Condos.
All right, everyone, welcome back to this week's episode of Brainstorming with the Docs. This week, we have a very special and unique guest, my good friend and colleague, Dr. Jon Hartman. We did an interview with him on some newer therapies that are being implemented and used within the sports rehab world and the neurology world. It's something that he's incredibly passionate about, something that he's incredibly well-versed on. Today, he's going to be talking about blood flow restriction therapy. And not only does he give you a lot of the data that is coming out, some of the practical therapeutic applications, but also his personal story about how he got interested in blood flow restriction therapy. If this is something that you are interested in, or you're someone that's suffering from, an injury, whether it was at work or a sports injury or even stroke or something like that, this is going to be an episode you definitely don't want to miss, because he dives super deep into how applicable this can be to each and every one of our lives. So without further ado, please enjoy this interview with my friend, Dr. Jon Hartman. All right. Good morning, everybody. What's going on? My friend, Dr. Jon Hartman. How's it going, bud?
What's up, dude?
Little burning the old morning oil for us. So Dr. Jon is a chiropractor, board certified functional neurologist, fellowship through the American Brain Injury Rehabilitation, right? What else are you? Give us your credentials, all that good stuff.
Chiropractic neurologist. I went through the American Chiropractic Neurology Board and the ACFN through the Carrick Institute, and went through the board training in brain injuries and rehabilitation, funk neuro, and vestibular rehab.
Excellent. And don't you have a diplomate from in exercise science or something like that too?
Rehabilitation as well.
Nice. So I've known you for, what has it been, 7 years now? Has it been that long already? Met you when we were doing our neuro diplomate, and you're a little bit more well-versed in the sports and rehab side of it than I am. And I figured that you would be a good person to interview on some of the new stuff that's coming out as far as rehabilitation and stuff like that. So why don't you tell everybody what you decided the topic we talked about, and maybe give us the lowdown on some blood flow restriction stuff.
Sure. Well, thanks for having me, Kolby. I really appreciate it.
Yeah, of course.
As much as I might have taken, I started off in a different path. I started off in sports and orthopedics first. So I became pretty heavily rooted and grounded in the ortho rehab, sports rehab world. And then I got into neurology, kind of finding that unmet need for the patients who had sports injuries who ended up having a history of concussion. So I ended up walking in your footsteps, going down the neuro world, and I've just been able to kind of add a couple layers of my background into how I serve patients now. One of the things that we do in our office a lot of is actually called blood flow restriction therapy, or BFR, or PBFR, which is personalized blood flow restriction therapy. And I kind of got into this, to be honest. I ruptured my quad in 2019. I was coming down a mountain backpacking out west, and there she went. So after we had that repaired, I was actually sitting on my couch feeling sorry for myself. And then Alex Smith had that episode on E60 on Sports Center. He was the quarterback. And
yeah,
he had that
the guy that when he broke his leg for, was it the Redskins, right?
Yeah.
Or the Washington football team, the Commanders.
Right. Yeah. Whatever it is now. So when he actually had that compound fracture in his leg, he ended up having some real bad surgical complications.
Yeah, he had staph, didn't he?
He had necrotizing fasciitis, or gangrene in his leg. So they were about to amputate for the knee down. And they were able to save his leg, and they grafted muscle from his contralateral quad to actually make new tibialis extensor musculature. And he underwent, I believe it was 18 or 19 surgeries over about a year and a half. And the complexity of his injury was actually so great that he had a letter signed by the Secretary of Defense to have his therapy done in a military hospital down in San Antonio, where blood flow restriction therapy started. And I was watching that episode just a few days into my surgery, and I knew then and there that this is a no-brainer.
This is something I have to add to my own therapy.
Yeah, this is a no-brainer. And then COVID came, and that put a damper on things. But long story short, Johnny Owens is the physical therapist responsible for starting this program called Owens Recovery Science. And they are one of the postgraduate education companies that, in my opinion, set the gold standard in terms of the academics behind blood flow restriction therapy. There's a ton of knockoffs. There's a ton of alternative options now that are coming out, but the Delphi pneumatic tourniquet has a patent on their microchip. Basically, a lot of science words for it. They have the safest and most efficient or efficacious tourniquet system. And that's what we use in our office at the Hartman Center. And I was test subject numero uno. And I can tell you, Doc, that from firsthand experience, it's changed my life.
Well, so why don't you explain a little bit what it is?
Sure.
Even because some people might go like blood flow restriction. What is that? Like, I've never heard of it.
Yeah, it sounds scary, right?
And it's really new, right? There's not a whole lot of people that have been exposed to this unless you're dabbling in our world a little bit.
Not in civilian. In military, it's been used for just about a decade. And it's slowly made its transition, maybe in the last 5 or 6 years, into civilian use. And it's been, so what it actually is that, well, I can speak to the Delphi unit because that's the one I'm most familiar with. Is that, you know how you take your blood pressure on your arm and you can have it done electronically? Well, what the device will do is actually calculate by taking the blood pressure on your arm or on your upper proximal thigh. It'll find out what is it's called limb occlusion pressure. Okay, so it's not necessarily your blood pressure, but what's the limb occlusion pressure? And it's how much pressure does it take to actually cut off blood supply going in and out of a limb? Okay. And then from there, the device will actually calculate, okay, well, what's 80% of the occlusion? So in other words, you're going to be doing an exercise with 20% available blood flow because 80% of it is blocked or occluded. Okay.
So what is the benefit to doing that then?
So what that does is it allows the physician to create, in a controlled environment, a really a significant stimulus in a controlled environment. So rather than, let's say, lifting 35, 45-pound dumbbells for doing curls, the brain needs a certain level of adaptation and intensity in order to facilitate a response, right? So you and I work in the world of brain-derived neurotrophic factor, insulin-like growth factor, vascular endothelial growth factor, stem cell growth, testosterone, right? We're familiar with all these terms, but when I explain this to patients, muscle gets bigger in response to high load, significant demands, right? And well, what if you just had a bicep rupture, or in my case, a quad rupture?
Yeah, you don't want to put a huge load on it, right?
You can't put a huge load. So how can you progressively load tissue in a controlled environment and still get adequate stimulus for strength and hypertrophy or neuromuscular development? And that's through BFR. So rather than
off some of the blood flow to it, then you don't have to put a huge load on it,
right? Because
there's lack of blood or oxygen-rich blood in the tissue.
Exactly. So, and now what the research is showing is that there's actually therapeutic benefits to the presence of, you've heard of lactic acid and all the metabolites. I can control, or through through blood flow restriction therapy, I can actually control that tourniquet. I can change the pressure to the intensity of what the patient can tolerate. And in the case of a bicep rupture, I can give them a 2-pound weight, but I could make the brain interpret the stimulus as if it's a 30-pound weight.
Yeah, that's
and
amazing.
That allows
actually.
me to, I mean, the research is showing that you can improve like cross-sectional diameter of muscle. And now there's some promising research coming out about therapeutic benefits of tendon and ligament. And
so for those of us that aren't like doctors, what that means is like the muscles gets bigger. The cross-sectional diameter of the muscle, what that means is like every fiber and myofibril and stuff like that in there gets larger, right?
Yeah.
So basically you can do an exercise with limited amount of weight and get a therapeutic benefit of something where it would be the equivalent of lifting a pretty severe or pretty extreme weight.
Higher weight.
Yeah.
A higher weight. Because if you want to take it to failure, you can.
Yeah. But with a lot more safety, because you're looking at it and there's a lot less incidence and likelihood of injury when you're not using a super, super heavy weight.
Right. And that's what allows for like linear progression of progress. You know, sometimes there's highs and lows with therapy, and sometimes you just have a regression, and you can really limit these things because when you're pushing the patient, it's up to the patient's tolerance. It's not necessarily the load that allows for that. And the applications of blood flow restriction therapy, I mean, it's really exciting to see how far this will continue to grow and reach, because I'm sure that within another 5 or 10 years, this will be the standard in most therapy and rehabilitation offices.
Yeah, you're going to start to see more in physical therapy offices,
absolutely
offices.
Yeah, I mean, like because blood flow restriction therapy really allows for think about like muscles and tissue, muscle, tendon, and ligament are responding and growing to adaptation, but we also live in the brain-based standpoint of rehabilitation. So we know that atrophy after surgery, like 60% of atrophy within surgery happens within the first 2 weeks of immobilization.
Yep.
That's hard. I was in a cast for 2 months. My thigh looked like my forearm. There was nothing left to it when I took my cast off. So it was really challenging to like go up and down stairs, let alone try to do a 10-pound knee extension. I could barely extend my leg
by itself. Yeah.
But just by putting the tourniquet on, I was getting therapy, just extending my leg, just trying to go up a stair was therapeutic for me by using the tourniquet.
That's super interesting.
It opened up, it really helped me from the progression from complete immobility to just starting care. And then especially as an athlete, getting back into return to sport. I love to CrossFit, and that's not easy to do
when you
after such a significant trauma. Right. And from a neuromuscular brain-based standpoint, we know that we can use blood flow restriction therapy to improve brain's connection and adaptation to tissue, right? So you and I get all jazzed up about the motor and sensory areas of the brain where we can use to improve its representation in the brain of a limb. So now we can use this on stroke patients. We can use this on Parkinson's. We can use this on MS, concussion, brain injury, because we're improving the proliferation of stem cells and growth factors into tissue to help with recovery. And what's awesome is the research is showing that there's some promising effects on this.
Yeah. Well, the nice thing is too, is because it's super safe, right? So we look at it, you're getting a lot of the therapeutic benefit, like you're lifting a lot heavier weight. It's really, really safe. It's really, really controlled, like you said, and there's really no contraindications to it, unless I guess you could see, like, if someone had some issues with arteries or veins where they'd been aging or something like that, maybe that would be a contraindication you'd want to
even
talk
maybe
about.
But for that millions of times that this has been done so far, the relative like complications are, active cancer, pregnancy, open wounds. But in the military, to the extent of which they've used this, we live in the world of military rehabilitation. When our special forces get hurt, on the job. There might be a blast injury from an IED, and unfortunately, some of these guys might be going through multiple surgeries, and they might have gone through multiple surgeries, and they might have been on a hospital bed for up to a year.
Right.
And they're still doing BFR.
That's amazing.
So I got to say, through the Owens recovery, through the educational coursework that we went through, was just inspiring. It really set a new level of understanding the deep physiology of blood flow restriction therapy and our comfort level with who we're able to use this on. Good morning.
Can you say good morning? It's still pretty early here, huh? Yeah. Is it dark outside still? Yeah, still dark out. Well, that's awesome, man. I appreciate you being on. If someone wants to get a hold of you, what's the best way to do so?
They could check out our website. Our phone number's on there. My phone number is 201 my brain. And yeah, that took a while to get though. And email's on there. It's info@thehartmancenter.com.
And I'll put all this information in the description and the links. And yeah, thanks again for being on, man. I really appreciate it. I know it's kind of early where you're at also.
No, it's my pleasure. It's always a pleasure getting to talk to you, dude.
Yeah, man. It's as you know, it gets hard when you get multiple parties involved, and then you have kids and teething and your projects or whatever. So I really appreciate you taking time out of your day to do this.
Oh, it's my pleasure. She's
Oh yeah, yours is awake too, huh? But
So,
all right,
no,
man.
it's a
Well, I
pleasure,
appreciate
man.
you. We'll talk to you soon.
all right, man. You have a great one.
All right, you too.
Well, that was absolutely amazing. You were telling me about this, and I was like, okay, blood flow restriction. Well, I don't know anything about it. I'll be entertained, but the passion this guy has in it, and his personal story, blew my mind.
I mean, it's pretty amazing when you consider that I commend him. I love Jon. I talk to him really, really regularly, and the guy is an absolute bloodhound when it comes to things that he gets interested in. And when he starts to research and implement things, he is absolutely amazing. When he first started telling me about this, it was kind of like a tease, I guess, where he was like, yeah, I've been doing this and this. We're in this big group chat with our colleagues. And the more I got to talking to him about it, the more like passion I could hear about it, the more interest that I got into it. I obviously don't have the experience of the therapy or implementing it in my practice yet, but I think it really shows you just how much we are advancing as far as our understanding of the neurophysiology of things, and just how far we have come in the last 10 years, and what it's going to look like in the future.
Yeah, and I was when he was talking about the recovery time, I truly did appreciate how during rehab, musculoskeletal rehab, there's these setbacks. There's that increase in improvement, then a setback, more potential setbacks, versus
Right.
when you're using these therapies is more linear without those drops. And I never, that's not the world I work in. So I was really, really surprised that it was actually due to injury, where you have these setbacks and how you can so I guess the takeaway for me is the reduction in injury and having that linear improvement, and how reducing blood flow can actually create that benefit. And then another one that really hit home for me was when he talked about the muscle atrophy right after immobilization right away because of the lack of movement. And then when you lose all that muscle tissue, it sets you back significantly. But if you can use this blood flow restriction strategy to start training or even moving your arm, as he said, or his leg.
Yeah, his quad, right?
Yeah, his quad, with his story, that the recovery time could be significantly different.
Right. And I think that the thing I appreciated the most after I'd talked to him is because I wasn't super familiar. I mean, I dipped my toes in it, right? So I wasn't as familiar with it as he is. But when you look at, by occluding some of the blood flow to certain injured tissues, that you can actually like get the same therapeutic benefit from less weight, is pretty substantial for me. Because you look at it as like, I mean, how many people? I had one today right, that had just had their it was funny because, we're reviewing this right now, and I'd had a person with a biceps tear in today, and I was like, how useful would it have been? Because this guy went through PT, did everything, and actually went to like pull start his boat, and as he was pulling it, retore his bicep.
I've seen that so often.
Can you imagine if we had implemented this therapy with this guy and started it early and often?
That's right.
What his prognosis would have been, and how likely would he have been? Would he have been less likely to injure himself again if we had done this therapy? I mean, the research is suggesting probably, right?
Yeah. And not only that, I was just thinking, it just came to my mind. What about the geriatric population? Like,
yeah, absolutely. You don't have to use,
say 70 and up, 75 and up. Well, what happens then when they get into an injury or a tear? Muscle atrophy is like the kryptonite. You can't tolerate that. There's already a lot of sarcopenia going on, a loss of muscle mass. So if there is injuries in that population, this should kind of be the gold standard.
Yeah, and that's his belief, is that in the next 5 to 10 years, this is going to be the gold standard. Everyone's going to start implementing this because it really makes sense when you consider that. And he went over the contraindications: cancer, pregnancy, open wounds, all this kind of stuff. Like, yes, there is some situations. We talk about this all the time on this podcast about how there's not a protocol for one size fits all for everything, right? But you consider like there's relatively limited complications or contraindications. There's a massive amount of therapeutic benefit with less weight and in a more controlled, safe environment. Like, why would we not start to use this stuff?
That's right. Yeah, that's exactly right. So anyway, I'm really glad he was on the podcast. I'm really glad that you had him as a contact.
Yeah.
And I think once you start learning about these things, it's like even myself, I'd be trying to hunt this guy down or the technology to try to use it.
Oh, 100%. If I was injured, you can bet that I would. Yeah, this would be something that I implemented in my own care. He is just a wealth of knowledge, so I'm sure that we'll be talking to him again in the future. I will say that maybe the next time I will try to put it at a time where it is not like super, super early in the morning. As you can see, the little boss, as I like to call her, the little boss of the house, I ended up waking her up. So she was an unexpected guest on our podcast as well. You guys will have to let me know what you think about the Paw Patrol pajamas.
Yeah.
So I will put the contact information for Dr. Jon in the link and the description. If you'd like to get a hold of him, all of his contact information will get on his website. If you'd like to get in contact with us, our email associated with the podcast is info@brainstormingwiththedocs.com. You can get a hold of us on our website. Mine is northlakescheropractic.com. Dr. Glenn's is drgharrison.com. Or just keep listening and turn on notifications, hit like and subscribe, because we're going to keep rolling out content like this. If you guys like us doing interviews like this, we'll continue to do that as well. Or if you have a topic you'd like us to cover, let us know, because we'll do that as well.
Yeah. Well, that sounds great, Dr. Kolby. I'm glad that you got him on, and I look forward to the next one.
All right, buddy. Sounds good.